If you were to ask me, what's the single most powerful thing you could do to reverse aging, mitigate disease, I would say melatonin. 400 times more melatonin is secreted from the gut than the pineal. Melatonin is not just for sleep. Every cell in your body is basically being protected by melatonin. It's the ultimate resilience molecule. When things get stressful, when things get inflamed, melatonin comes to the rescue, but it's declined so quickly as we get older. And so we don't have enough melatonin to really help keep our body robust and buffer a lot of these oxidative activities. We think about battery power in our cells. As we have more inflammation, the battery power goes down because the cell danger response. We have to start deriving energy from fermentation, which is 10% as effective as through the electron transport chain. When we can supplement with melatonin, it repairs this whole process so that we start making energy normally again. When an organ or a cell starts to get more energy, it's going to start doing some things that it's been putting off. I'm 56 years old. What I've gone through in my life, like I shouldn't look like this. It's melatonin.
John, your health journey begins all the way back before you're even born. Camp Lejeune. Talk about what went on there, and then we'll build on that.
Yeah, well, preparing for this podcast, I went in and looked at some of the videos on your YouTube channel, and there was an interview with a neurologist about the root of Parkinson's disease. And I felt like I wanted to just kind of listen to you and your channel and just kind of get a flavor, just kind of get ready because I wanted to really just do the best I could for this recording and just give my all. And lo and behold, he starts to talk about Camp Lejeune, and that really got my attention because that's part of my journey. My father was a Marine, and he was stationed in Camp Lejeune when my mother was in utero. And the first 2 years of my life, my dad now has leukemia. It's a very slow growing. It's a B cell lymphocytic leukemia, which is one of the better ones to have. My mother has crippling arthritis. My sister has a lot of health issues as well, and I've had health issues since a young age. I was always very sensitive, a lot of allergies, severe asthma, hospitalized more times than I can remember, a very dysfunctional immune system, and then had a lot of. This is what I think what happened was that because I had such a fragile immune system from the toxins in Camp Lejeune, which, by the way, were basically the groundwater was contaminated with some of the most, destructive chemicals from the dry cleaning, and so these leached into the water, and so it was in the water supply, and so I think what happened with me was it caused a dysfunctional immune system that led to a lot of inflammation that then created some neurological things that set up for dyslexia, ADD, ADHD, hyperactivity. I was kicked out of 3 different schools living in Hawaii until I finally ended up into the absolute class that you didn't want to be in, which I was surrounded by what I felt was people I didn't really belong in that environment. But in Hawaii, they had such a disparity between the extreme challenged people and the normal classes. So I was basically taking the short bus to school, and that was a very big part of my early education was in these classes. And so it was a very challenging childhood, and I really had no idea about this Camp Lejeune until much later in life. And the more I learn about it, the more I reflect on me and my family. I can see how destructive these chemicals can be to your health.
For somebody in your boat or otherwise exposed to these chemicals, well, one, do we know specifically what they are? You mentioned dry cleaning. And then 2, how does somebody get those out of the body, or can they?
A lot of these chemicals, they are fat. They get in your fat, and the fat toxic load is much more significant than the water soluble. And particularly these toxins like to find themselves in the cell membranes in the body. And so these cell membranes are basically like a lipid bilayer that surrounds every cell, and it really protects the outside world to the inside world of these cells. And it also acts as a signaling sensory kind of dome. And so when we have hormones, they act like lock and keys, and they actually attach themselves to the cell membrane and trigger certain biological effects at a cellular level. And oftentimes these toxins find themselves. I think about it like, all these satellites that we're putting into orbit, right? Think about like how cluttered space is getting, and I think about this kind of cluttered space, and I think about that like our cell membrane, where we get all these toxins starting to clutter around our planet, our cell, right? Because you could almost think about the Earth as being like a cell, right? Um, it's a whole ecosystem. And so these toxins get into that space, into the cell membrane, and they affect the cell in so many different levels. They starve the cell of nutrients. They have a negative effect on the lock and key with hormones, with thyroid, with um, insulin in particular. Those would be on the top of the list. They create a lot of problems, and then they lead to autoimmunity, because when these toxins integrate into our tissues, the body doesn't just attack itself for no reason. I mean, modern medicine has a lot of great medicines that block the expression of a symptom, but I liken it to painting over rust, right? And so a lot of these monoclonal antibodies and a lot of these different other medicines for autoimmune conditions are really blocking an expression but not fixing the root cause, which is, why is the body attacking itself? So this whole family of autoimmune conditions um, are, in my opinion, and there is research that supports this, that it's attacking the toxins as non-self and infections. Once we get a toxic burden to a certain level, I liken it to kind of like you're a swamp or a river, right? As you get more polluted and there becomes more like acidity or toxicity, they've shown in research that like mercury laden tissues are extremely favorable to a lot of parasites and a lot of certain bugs, and so they thrive in these environments where we don't. So it kind of steps back to the terrain idea, right? So is it the microbe, or is it that the terrain is favorable? We look at like growing plants, we think about the soil, right? And so certain sets of circumstances and certain characteristics of certain soils are going to lend itself to maybe weeds and plants that we don't want, right? Where a certain type of soil that's rich in magnesium and minerals and so forth, and it's not too acidic, you're going to be able to grow beautiful vegetables, right? This is organic farming at its best, where the soil is really a big aspect of why that plant is so healthy. And so then we think about our body, and we think about the soil and the terrain, and that's where these toxins become so detrimental.
Okay, so you've mentioned toxins and infections, and these are your two root causes of chronic disease. Somebody right now feeling tired, they have a disease, they're feeling sick, something's off. How do they go about assessing for both of those?
I've learned through my own pain to purpose process, and so I've had some challenges. I mean, Camp Lejeune was, I think, an early set, but then later on in life, I got Lyme disease and mold illness really severely. My Epstein-Barr viruses were among the highest titers we've ever seen. Um, and then in the last couple of years, I wound up having a severe injury and injured my leg and went to the hospital. And this was kind of during the hurricanes, and there was a lot of shenanigans going on at the hospital. And I don't really feel like basically it led to my leg getting amputated. And for those who have been to the hospitals and know how it's like, I question whether that outcome had to happen. And then to make things even worse, when they amputated my leg, they did it, I guess, they got bacteria in there, so I wound up getting osteomyelitis and a bone infection, which is very difficult to get rid of. So it was another 9 months of IV antibiotics and bed rest and several more surgeries. So even through that process, I've also learned just more layers of how to test the body, how to manage very sick scenarios. I was extremely ill even just last year, very, very weakened with the antibiotics and just bed rest for a couple of years. Um, and so, these are good questions. So I guess let's look at there's blood work that can be done. Some of my top markers would be like TGF beta 1. Are you familiar with that marker?
No, tell me about it.
Okay. TGF beta 1 is an inflammatory marker, and it's available at LabQuest or um, LabCorp or Quest. So real common. And TGF beta 1 is elevated oftentimes when we have a lot of mold illness. So if there's a lot of toxicity in general, this is going to be a general marker that's going to kind of show us, okay, there's inflammation in the body. It's raising this TGF beta 1, which is a inflammatory marker. And it's also potentially going to suggest that we have chronic infection. And so the research on TGF beta 1 suggests that high viral titers like Epstein-Barr, cytomegalovirus, or HHV6, those are the three that we really look at quite a bit. Lyme disease can cause that, a lot of mold exposure, or it could also be other environmental toxins. And then when TGF beta 1 gets high, what's really interesting about this is it causes a tremendous amount of fibrosis to occur in the body. Okay. The area of the body that primarily gets us in trouble is the lungs, because once the fibrosis kicks in those lungs, then we can start getting COPD, and we lose the ability to pull oxygen, from our environment and oxygenate the body appropriately. And this is really an interesting idea that, okay, so if most COPD cases are from fibrosis in the lungs, which is what you find when you look at COPD, and this is a downstream event from high TGF beta 1 levels that are caused by infection and toxicity, poor air quality. I mean, we're breathing poor air quality. That's a part of the toxicity. We start to understand, well, there is a root cause to COPD that we might look at. And I don't know any pulmonologists that are looking at TGF beta 1, because we work with regenerative medicine with COPD and lung conditions with stem cell therapy. Actually, um, you know, one of the treatments that works really, really well for lung conditions, with when you do stem cells intravenously, first pass goes through the lungs. And so this first pass means that the stem cells get stuck in the lungs. So if we're wanting to, say, do a treatment like our brain protocol, where we want the stem cells to go to the brain or some other area of the body, then we would want to give heparin, that basically is a blood thinner that doesn't trap the stem cells, right? So there's ways to administer stem cells where you can get a very high amount of them to go in the lungs. And so the results that we've seen with COPD, with looking at TGF beta 1, managing these inflammatory markers, getting rid of the cause of the fibrosis, and then treating that fibrosis with a combination of stem cell therapy. And then we have them nebulize a peptide. Everybody's talking about peptides these days, right? So let's not let the audience down. GHK copper peptide, if you look at this peptide, you'll start to see the relationship it has to TGF beta 1, and it actually helps to reduce fibrosis in the body. So that's one of the clinical benefits of taking this peptide, is reducing fibrosis. So we actually have a product called Breathe that is a nebulized formula of GHK. So that has been really powerful. I know we kind of got a little bit sidetracked. You were asking me about toxins and testing, and that spent a lot of time on that one.
Well, you mentioned this one marker that I wasn't familiar with, TGF beta 1.
Correct.
I know about highly sensitive C-reactive protein. Is that kind of in the same ballpark?
That is another good one. It's good to do that one as well. And oftentimes, um, CRP can be normal, where high sensitivity CRP, or they also call it cardiac CRP, will be elevated. My CRP, so normal CRPs, you want it to be like, less than 5, 3 to 5 or something like that. I had a CRP over 100 at one point, and this is when my bone infection came up. So we did labs. I felt terrible. I thought I was going to die. The anxiety was absolutely through the roof. So we did a blood test, and my high sensitivity CRP was just astronomical. So it was like straight to the hospital after that. But so that's a good one to do. I think that would be an important part of anybody's panel, that especially if you're dealing with a health problem, or you're really interested in preserving your brain and your heart, and living your maximum life. This is a good marker. Another one is MMP9, and MMP9 is another inflammatory marker that's kind of similar to TGF beta 1 in the similarities that, like, infection can get it to raise up, and that it's commonly elevated with mold exposure or toxic exposure. And of course, um, there's a lot of different ways you can test heavy metals. There are tests where you can look at the hair, you can look in the urine, you can take a provoking agent and then collect your urine for 24 hours and look at the toxins in the urine. There's blood tests that can be done. You typically, with heavy metals, they like to use what's called a provoking agent or a chelating agent. And so you would do this prior to collecting the sample to kind of dislodge heavy metals. And then you get a bit of a flavor for like what kind of burden an individual might, because you could do one of these tests and it would be normal. And then you do a provoking agent and then it's like, wow, you have a lot of toxins there. And so what that would suggest is that you're not a good detoxer, right? You're not clearing it. So it's not showing up. It's kind of a hidden. Hair is interesting because it's not going to really deal with those fluctuations. Some people like to do the try test. I think Chris Shade does that with Quicksilver, where they test hair, saliva, and urine, and that kind of get an idea of all three. And then the way that we test it here is through the skin, and it's using like light and photosensitive a device called an oligoscan. And not only does it let us look at heavy metal burden, but it also looks at minerals, all the minerals in the body. And so we use these as markers when we're first working with a lot of our patients, to make sure that we're on the right path, and we're able to see what their toxic burden with heavy metals are, and also what type of deficiencies they might have with minerals. Minerals and heavy metals really have a relationship, because heavy metals displace minerals. So when anybody's going through like a detox pathway with heavy metals, it's good to take minerals, because the minerals can kind of displace the heavy metals, and it aids. And then binders are also really important for those embarking on a heavy metal a detox program, because once we get rid of those heavy metals out of our cells and tissues, what happens is they find themselves in your liver, and then it's dumped into your gallbladder, and it's in your bile, because that's where we get rid of the fat soluble stuff, right? So it's in the bile, and then the bile is released into the small intestines, that then goes into your large intestines. And at the end of your large intestines, your body reabsorbs that bile, okay? And so it's going to reabsorb those toxins, and it's going to carry and loop those toxins through your gut over and over and over again. And they call this the hepatobiliary enteric uh, cycle. And so we want to use binders to basically capture those toxins so that we clear them out. And I would almost offer that everybody should consider doing a binder on a daily basis. And the best time to do those are times where your gallbladder is going to be releasing bile, which is in the morning, and then before you go to bed at night, because there's that first hour of sleep, there's a nice release of bile. So that's a good time to take a binder. I personally like Chris Shade's Ultra Binder with Quicksilver. And between 2 and 4 of those capsules is a good dose.
So you do that morning and night with the Ultra Binder?
Yes. Yeah. And now individuals that have significant mold illness, where we're concerned about water damage in their house and so forth, we start to look at some prescription binders, particularly one called cholestyramine. And these mycotoxins, these mold toxins, aren't really mopped up very well. They're not captured very well with the traditional binders because the charges aren't right to capture them. And cholestyramine works really well, but you need a prescription. And most of the cholestyramine that you can get at the pharmacy has a lot of aspartame in it, and it's really nasty. So we utilize a pure form with our cases, and I would encourage anybody that's looking to kind of look into that to try and source it not from their local pharmacy.
All right, so we have these binders. When it comes to detox, we have saunas. How effective are those? Is that something you include in your protocols?
Oh, yeah.
And then other modalities related to detox while we're here.
Well, think about the idea that we're either a swamp or a river, right? And so this idea of circulation, is really important. And we look at that in our many different aspects of what we're doing here clinically and just navigating like the best practices with biohacking and such. Um, Looking at the quality of the different types of tissues in your body. Some are more dense than others. There's some things that don't get the circulation that other areas do. We look at the brain and the lymphatic system and the importance of that for neurological health. We look at the prostate, and we understand that the prostate has poor circulation, and that stagnation can lead to microbial overgrowth that I would offer is the root cause of benign prostatic hypertrophy, which long-term leads to cancer, which is the second leading cause of death in men with cancer over the age of 40. Big. And we're doing some exciting things in that field, which we can talk about at some point. But just kind of wrapping up this idea that, how do we detox and how do we put together a routine in this extremely toxic world? Well, number one, we want to stay away from toxins, right? I love in your episode where you guys talked about groundwater and you talked about healthy air. Like I think having an air purifier in your bedroom is really important. I think looking at your AC unit, making sure that it's clean, and that maybe having a UV filter in your air conditioning unit, and ozone devices can be really helpful in the house to clean the air. And so then there's, healthy, pure water, right? Like whole house water purifiers and purification, making sure that your water's clean, your air's clean, your food. So you just start to kind of look at, okay, we don't want to be getting more toxins than we need into our body. And then saunas are fantastic. I am a huge fan of saunas and do it probably anywhere from 3 to 5 times a week. And, sweating is one of the ways that we get rid of toxins. And there's been numerous studies showing that doing saunas regularly really reduces all cause mortality and can extend life and mitigate a lot of diseases. So big fan. Hyperbaric oxygen is something that may not be available to everybody, but can be really great at helping the body detox. Did you know that melatonin detoxes the brain from heavy metals?
No, talk about it.
There was a study that they found that, and the way that I would describe that this works, and in melatonin in general, I know we spoke about it on our first podcast, so we don't need to get too far into the weeds with it, but it's the ultimate resilience molecule. In other words, when things get stressful, when things get inflamed, when things get toxic, melatonin comes to the rescue, but it's declines so quickly as we get older, especially after the age of 40. And so we don't have enough melatonin to really help keep our body robust and buffer a lot of these oxidative uh, activities. So basically, inflammation is the mitochondria's worst nightmare, right? So we think about battery power in our cells. As we have more inflammation, the battery power goes down because the cell danger response. We have to start deriving energy from fermentation, which is 10% as effective as through the electron transport chain, which is what the mitochondria does. When we can supplement with melatonin, what happens is it shifts the energy back into the mitochondria and it repairs this whole process so that we start making energy normally again. And when an organ or a cell starts to get more energy, it's going to start doing some things that it's been putting off. Okay. So maintaining kind of like imagine if you're like a spaceship, right? And you only have so much energy, but you got to get back to Earth. You got several days before you get there, but you only have enough energy for like a day. And you're like, well, if I turn this off and I turn that off and I do this and I breathe slower and I really conserve, maybe I'll make it, right? Well, the cells do the same thing. They basically shut down whatever they can when the energy's low to basically have the energy for some of the more vital functions of that cell. And so when you start to replete that energy, which melatonin can do, then it's going to start doing some housekeeping. And so this is when we start with what I call super physiological melatonin dosing, and I'm talking a couple hundred milligrams. Most of the animal models and the research is suggestive that about 180 milligrams for the average adult tends to do some pretty exciting things. And so it does that because you're buffering this stress response that is from all the toxins and all the challenges that we have in industrial living, right? That we're not living out on an island or out in the jungle and natural and eating whole foods and sleeping when the sun goes down. I mean, there's just so many aspects to this ancestral living that we're so displaced from, and it causes a lot of stress. And so we need to buffer that stress. And the way that we do that is through melatonin at the corest of core places where it counts the most, which is right inside the mitochondria. And what happens is the studies show that when the stress gets really high, that energy just shuts down and a lot of people can die in that scenario. That's what happened with COVID with the cytokine storm. And that's what happens with most old people will die of a pneumonia, and it'll be because they don't have enough melatonin to keep the energy going in the mitochondria. And there's numerous studies that show that supplementing with melatonin with infections mitigates a lot of the mortality. And in some instances, incredibly severe, dangerous viruses that would just kill 90 something percent of anybody that would catch it, where they supplemented with melatonin and those numbers would be like 12% versus like 88% or 92% or something like that. So it's a really big deal. And so we kind of back to this whole toxic thing. When we start dosing people with melatonin, we like them to take binders because sometimes people feel like a little extra groggy when they first start doing these higher doses, or may feel a little off, the first day or two. Not everybody, but sometimes it happens.
Okay, let's stick on melatonin. Like you said, we did cover it deeply last time, but this is one of the subjects you're a master on, and I'm sure we can add to what we covered last time. So let's start really general. You're talking about high dose melatonin supplement, and you're talking about rectally. I know you're a suppository guy versus orally that most people would take if they're supplementing, say, at night to help with sleep. So not only is the dose a lot higher you're talking about, but also it's getting absorbed a lot better. So talk about the difference there between taking it orally and then taking it rectally.
I like to first maybe talk about when I was really, really ill with Lyme disease. I didn't know what was wrong with me. And the only thing that helped was at the time fasting. And so I lost a tremendous amount of weight. Everybody around me thought I was like on heroin or something. Something's going on because this guy's was 200 pounds, muscular. I had like a bodybuilder physique at the time. And then I went to like 147 pounds, I think, at my leanest. I mean, just emaciated. And then I discovered glutathione suppositories. And I tried, and I was desperate, right? I mean, I wouldn't normally be the type of person that would even be open to something like that, but then I was desperate. So I did this glutathione suppository, and I woke up the next day and I felt halfway normal. Like I really noticed a big difference on how it downregulated my inflammation. And I took a dive into glutathione and I found it, well, wow, it detoxifies heavy metals. It detoxifies all these chemicals, which I have a huge history with, all these chemical exposures. It's a sleep promoting substance. And it also is good for viruses. It's a viral antiviral. It helps with viral immunity, basically. And so it checked all those boxes, and I'm like, wow, okay. But you can't take it orally and get the same effect because when you ingest things orally, it goes through the digestive juices and acids and enzymes and so forth, which break down these molecules. And then there's something called first pass through the liver. So there's a lot of challenges with certain molecules that are more fragile to actually get into your bloodstream where they're going to even do anything because they're beaten up so bad going through all those steps. And so like NAD is something. So we started making suppositories with a number of these really amazing nutrients that really we felt would be beneficial both to myself and also to our patients. But like NAD and some of the precursors, NR and NMN, is in our NAD Max suppository. And then, of course, melatonin. Then I came across this study that showed oral melatonin's 2.5% absorbed orally. So it's like, okay, well, why don't we create a suppository that has both glutathione and melatonin and really catch, those two amazing molecules. And that's where the Sandman suppository came about. And then we added a little bit of CBD into that as well. And so those have been, personally very, very, very helpful. The other nutrients that aren't really well absorbed, and anybody that's consumed curcumin, they dose it with like pepper extract, right, to help with the absorption because absorption is very difficult. Is we started to create some polyphenol suppositories, and we utilize some, polyphenols are basically like what make these beautiful plants, that's the colors in plants, right? Like sterile stilbene, it makes blueberries really blue. And then they've done studies on sterile stilbene and found that it's a senolytic and it's anti-inflammatory and it's got anti-cancer properties. And so it's really good to do something like that when you're fasting because it mimics fasting in the essence that it helps trigger clearing senescent cells, which are these zombie cells. Fisetin from strawberries is another one. It allows strawberries to have that beautiful red. Green tea extract, resveratrol is powerful, um, and curcumin, quercetin. And so we have a suppository called Lucitol, and we use this for people with brain inflammation because a lot of these polyphenols really downregulate the immune response in the brain. So they're very good for people that have degenerative neurologic disorders or traumatic brain injuries, because they often have a chronic inflammatory process going on in the brain due to these cells in the brain called glial cells. And glial cells are the immune cells in the brain. And once they get kind of agitated, they don't really settle down. And so calming glial activation is a real big, important thing with neurological cases. And so the Lucitol is great for calming down glial activation. And we use it during fasting. So we have a program called Fast Track Fast, where it's like a whole fasting protocol that we put together. So like some examples of this would be, while you're fasting, you would do these strong plant polyphenols. And then after the fast, you might do high dose melatonin because melatonin is going to trigger microbiome swarming, right? So when you're fasting, you think you're actually like stressing the microbiome, and a lot of the bacteria are kind of going down in numbers, right? Because there's not a lot of nutrients for them to eat, and you're clearing a lot of the bad bacteria. And then when you start feeding again, you want to basically create that microbiome swarming. And what they found is that oral melatonin suppresses the bad bacteria and enhances microbiome swarming with the good bacteria. Therefore, there's like some really strong research and studies with ulcerative colitis and Crohn's disease and a number of other digestive conditions by using actually melatonin. You wouldn't think about this, but again, melatonin is something 400 times more melatonin is secreted from the gut than the pineal. Melatonin is not just for sleep. It's not just a sleep molecule. It is a molecule that is protecting your eyes, your skin, your gut. I mean, every cell in your body is basically being protected by melatonin, and it's just such an important molecule. And I believe that because of the stresses that we are under in modern living, that this molecule is incredibly important, I think, for anybody. Like if I were to be asked, and I've been in practice doing natural medicine initially as a chiropractor, and then eventually became a chiropractic neurologist doing functional neurology, and then going back to school, becoming a naturopath, uh, 30 years now. And I've seen a lot. And if you were to ask me, what's the single most powerful thing you could do to reverse aging, mitigate disease, and generally feel amazing, I would say melatonin, and not a little bit, but high dose, what's called super physiological dosing of melatonin. And this idea is something that I've been working with some influencers. I recently worked with Gabby Reese. I'm not sure. Are you familiar with Gabby?
Yeah, for sure.
So I became close friends with Laird through my journey. Actually, we somehow connected when I was like literally I was on the phone with Laird on my way to the hospital while to get my leg amputated, and he had a hip surgery at the same time. So we were kind of like sharing stories, and we're both surfers, and I grew up in Hawaii, and he's got a lot of Hawaiian roots and spent a lot of time out there. And then I flew out, and Gabby and I did a podcast on melatonin, and then I proposed to her. I said, why don't you do 90 days every night? And she's like, what? Isn't that going to shut down? It's like, no, it doesn't shut down your own production at all. There's no toxicity. And she just will go on and on about how much better she feels. And she had gone through a holiday season, and she's got the two girls, and I mean, just keeping up with Laird alone, that poor woman. But she just felt like it really helped her in a lot of ways. So we're really looking to kind of promote this 90-day challenge with the Sandman, and we have some discounts that we offer with people that decide that they want to do like the full 90 days. But that's where you really see the changes, like your skin. I mean, I'm 56 years old, right? And what I've gone through in my life, like I shouldn't look like this, but it's melatonin. Like without melatonin, I don't even know if I were to have survived the 2 months I was in the hospital, and the bone infections. And I mean, it was not, I had, my kidneys got so damaged from the trauma to my leg that I was on dialysis, and they were telling me that I would probably need to be on dialysis the rest of my life, and that I'm going to need to get my leg amputated at the hip. That was where I started out from. And so I had my staff bring in this mother load stem cell to do IV, because I had the IV hooked up. I'm in the bed. Staff comes in, and when the nurse left, we went ahead and hooked it up. And man, the next day I wanted to jump out of that hospital bed and just go and run. Of course, I couldn't because I had no muscle strength at the time. But a month later, my kidney labs became normal, and they said you don't need dialysis anymore. And I owe it to that stem cell IV that I got.
All right, we're going to come back to the full story there on the leg injury. But let's stick on melatonin here. You mentioned 90 days. Would that be at the 200 milligrams nightly rectally?
Well, we have 3 deliveries. We have what we call a bar, which are little squares that you take as a tablet. And these have the cannabinoid CBN. I've discovered that CBN is the best cannabinoid for sleep. If you've never tried CBN for sleep, I mean, it's fantastic. We have a pretty nice sized dose, 50 milligrams in each square. And so that is 200 milligrams of melatonin for each square, and it can be cut into portions as well. And then we have a liposomal, which is like a liquid, and then we have the suppository. And so the benefit of the suppository is that you're getting it into your bloodstream. You're going to have a higher amount get into your bloodstream, and it's also going to slow release over 5 to 7 hours, which is more like the way your body releases melatonin. So it's the best, right? But compliance wise, we really want to look at what's going to fit people's lifestyle and what they're going to be comfortable doing long term. Personally, I don't do a suppository every night. Um, I I really like the bars. The bars are you can keep them out of the refrigerator for a couple of months or so. I just leave it right next to my bed. It's very convenient. The liposomal would be probably the next best absorbable after the suppository, and then after that would be the bar. And you can do the bar and the liquid. Whenever you're taking melatonin orally, it's probably going to kick in quicker, and you can go to sleep. So sleep onset's a little bit better. Um, we do have cases where we will even walk up to 4, 6, and even up to a gram of melatonin. We have some, when you start getting into cancer, severe degenerative neurologic diseases, some diabetic conditions, we've seen some pretty exciting results with some of these really high doses with melatonin.
Okay, so when you're taking the bar before bed, you mentioned earlier how little gets absorbed. There must be a trade-off there, the reason you're still doing that.
Well,
Talk about
it
that. Is it because there's something about the bar that you still absorb a lot of it, or you're just getting different benefits?
there's 2 things. One is that there is a slow release with the bar, so it's not just normal oral. Um, and at this point right now, I've recovered, and I'm not really like dealing with like eh, you know a disease process. So I'll do the suppository maybe 2 or 3 times a week. On top of that, I'll do the bar. So that's about between 400 and 600 milligrams. I typically do 2 bars every night, which is 400 milligrams. So it's a good amount of melatonin, and a lot of the studies that they did with melatonin is oral delivery. So I would say, if individuals are like kind of looking to do it for human performance, for longevity, for benefits outside of like actually addressing a disease, then the bars are fine. And also it's your own, like, what are you willing to do? Like, what's going to be something that you're going to actually follow through with? And the bars are very simple. Now, if somebody has a disease process, they may want to at least look at doing the suppositories. Now, the other thing is the glutathione is really, really powerful. And we might even have people do the Sandman suppository has 250 milligrams of glutathione, but we have the Glutamax 600, which has 600 milligrams, which is really a better dosage for someone that's also, again, really looking at detoxing, really to really bring down that inflammation, and support, brain health and so forth. So doing both those together is also possible. Doing a Sandman and a Glutamax 600 could be really helpful.
You mentioned the microbiome swarming, and when you talked about that, you mentioned oral melatonin. Is that the only way you get that? And talk more about what that is and the benefits.
So the gut lining produces melatonin, and it does that in a circadian rhythm, just like we have times that we're awake and sometimes when we're asleep. When we're awake, we're actually doing our work, right? Microbiome's a little bit different. When they're triggered more when they're sleeping, they're growing and swarming. And so melatonin is the trigger for their circadian rhythm the same way it is for us. And so when they don't get that melatonin, they're not going to proliferate. But interestingly, the melatonin tends to suppress a lot of the bad bacteria as well. So there's some really interesting aspects to the physiology in the gut and melatonin that seem a bit divine in ways, the way that it's orchestrated. But the microbiome swarming again, the natural mechanism is the gut secretes the melatonin. However, as we get older, we produce a lot less. And as a consequence of that, there's multiple things that start to go south as we get older. Our mitochondrial function is hardwired. I mean, this is all over the research. The focus with aging is mitochondria. And so, of course, melatonin plays such a crucial role. We look at heart rate variability, and we look at this aspect of our sympathetic and parasympathetic nervous system, and how as we get older, or when we're in certain disease patterns, we tend to go more into the sympathetic dominant state, which is not a healthy place to be long term. It's overly stressed. We need that parasympathetic resting and digesting aspect for healing and for regeneration and for repair. And melatonin is the primary activator and supporter of the parasympathetic nervous system, full stop. Just like cortisol and, norepinephrine would be there, is the sympathetic nervous system, right? In the brain, you got norepinephrine. In the body, you have cortisol. And these are wonderful, wonderful, like neurotransmitters and hormones, but in excess, they're terrible, extremely destructive. And they need to be countered by their opposite, which is melatonin. And so if we start running low in melatonin, which we know we do as we get older, our heart variability is pretty much hardwired to the balance between the sympathetic and the parasympathetic nervous system. And oftentimes, when that parasympathetic nervous system starts to go south from low melatonin, then we don't have as much variability with our heart rate. And so we start to get a lower number in heart rate variability. We want a higher number. I've had some numbers with my heart rate variability that people just don't believe at my age. I mean, well into the hundreds. And it's melatonin. And then they look at heart rate variability as being like a huge marker for longevity and health and wellness. So a lot of reasons to consider melatonin supplementation.
You did mention quickly, but I want to come back to suppressing endogenous melatonin by taking it through whatever route. That is something a lot of people are saying. Talk more to the physiology there.
The research is very, very supportive that there's no negative feedback loop with melatonin. And it's, I think, hard to believe for a lot of people because it seems like they're the way that we're wired is that there are all these negative feedback loops like testosterone and estrogen and cortisol and insulin. All of them have this negative feedback loop where if we give too much of it exogenously, like as a medicine, we shut down our own production. This doesn't happen with melatonin. Melatonin is produced with light in the eyes, and that's it. So if you're putting your sunglasses on before you step out of the house in the morning, maybe reconsider that because you want to get some light in your eyes. Maybe you don't go out there and stare at the sun in the middle of the day, but you want to get light in your eyes because that's going to be the primary way that you're going to get signaling for this circadian rhythm. So you're going to be pacing these systems and rhythms in your body, which are really important. But again, as you get older, you're not going to have a big dump of melatonin because that's just what happens as we get older.
Okay, and for somebody starting on allowing, say they've been wearing sunglasses and not getting any sun in the eyes, how do they know dosage-wise what's going to be beneficial to start producing that melatonin? And this is just somebody, say, going out for a walk in the morning, not looking up at the sun, but just out there allowing the sun to make contact with the eyes indirectly.
Well, it's a good question. I've had days where I go out boating and I do wear sunglasses during certain peak times during the day when I'm out boating, but just getting like a tremendous amount of light, boy, do I sleep well. And so I do think that there's a benefit from getting like hours of sun. What's the minimal effective dose? Some people say 20 minutes a day, just getting out. Even if you were to get 5 minutes, I know like being in the city, when I'm traveling, I go to New York City, it's hard to even find a spot that has sun. And so it can be a real challenge for people. And there are red and infrared lamps that you can get that can kind of help with that a bit. And so, yeah, I'd say like 20 minutes a day. Um, I'd say if it's early in the morning, you might need more versus if it's in the middle of the day.
And how much are we going to make, do we know, compared to these super physiological doses, 200 plus milligrams?
There's two ways to look at it. There's the signaling for the rhythm, and then there's the actual how much melatonin are we going to make and dump for going to sleep. And obviously, if you're going to be taking melatonin, you kind of got that covered. But what you're not going to get when you're taking melatonin is you're not going to get some of the other signaling aspects to that light in the eyes, right? I don't believe that it's possible after the age of 40 to just get enough light in your eyes that you can get those melatonin levels up to what you could supplementing. I think it's just from my experience and my knowledge base, it's a no-brainer that people should be supplementing with melatonin. Exact numbers, there's a small amount that's produced in the pineal, um, very small amount compared to what's produced throughout the body.
Is the melatonin produced throughout the body different than pineal melatonin?
No, it's the same molecule. And also, saunas and red and near infrared light actually stimulate the release of melatonin at the cellular level. And that's actually one of the ways that is beneficial, besides stimulating um, endothelial nitric oxide. So, like with nitric oxide, there's different types. The inducible nitric oxides, kind of from an infection or toxicity. So I saw you did a podcast on nitric oxide as well, and I think that's a great topic because circulation is another real big challenge as we get older, and nitric oxide can be something that can really help boost that. And so, um, when we look at nitric oxide, we might even want to talk about methylene blue within that because I think there's some people that get confused about whether they should take methylene blue because it does mop up nitric oxide. But particularly, it primarily works on the inducible nitric oxide. And that's the nitric oxide that when it gets paired with nitrates becomes peroxynitrate. And this is the most destructive chemical. It's very, very bad news, very oxidative. You're my dog. Hold on, I'm gonna let her out. All right, I'm back. So neuronal not nitric oxide and endothelial nitric oxide are the good ones. And so hyperbaric oxygen really works on both neuronal and endothelial. And the saunas and the red lights and the near infrared really work on the endothelial nitric oxide, so they can be really helpful to improve circulation and naturally boost, these nitric oxides. But we really don't want chronically high inducible nitric oxide. And methylene blue, one of the postulations on why methylene blue is so effective at boosting mood is the idea that depression is caused by high inducible nitric oxide. And they've done studies where they took individuals and they lowered their nitric oxide and their depression symptoms went away. And then they would raise that inducible nitric oxide and the depression would come back. And so there seems to be like a correlation with mood and neurotransmitters with the inducible nitric oxide. And so what would be causing that nitric oxide, that inducible nitric oxide would be probably a chronic infection, possibly toxicity. And so then we think about, okay, well, the person's depressed. What's the root cause of that? Because that's what we want to treat, right? We wouldn't want to treat this downstream symptom with particularly an SSRI, which, boy, we can get into. Listen to this. This is really, okay. I'm going to blow your mind. I hope I'm going to blow your mind. It blew my mind when I found out about this. We are constantly looking to integrate ourselves by taking short-term memory and integrating it with our long-term memory. And this happens during sleep, particularly REM sleep. Okay. This is where our eyes are moving around. And it's almost, I think about it like we're defragging a computer, right? The computer's going through a defrag program. And so, like, let's say that we had a situation. Well, I mean, let's look at me with my leg, right? I mean, I got my leg amputated. I mean, that was a pretty significant event. And imagine if I wasn't able to integrate this event and I kept looping on, oh, my leg's getting amputated, my leg's getting amputated. Over time, I start to adapt to this new life and I start to um, become okay, basically. And, looking at being grateful for what I still am able to do and making the best out of the situation. And the way that that's possible is by memory consolidation. Okay. So this aspect of memory consolidation is when we consolidate our short-term memories with our long-term memories. And the only way that we do that, the window into doing that is through REM sleep. Now, SSRIs totally block memory consolidation. It blocks REM sleep. So you imagine the primary drug, the primary treatment for people that are having mental emotional problems is blocking them from integrating these problems, right? We get these warriors that come back from war, and we have more people commit suicide than died out on the field, right? It's because the way we're dealing with these wounded warriors and these soldiers that have PTSD. Also, opiates block REM. Opiates. I was on strong opiates for well over a year. It's probably a whole nother podcast we could do on my Ibogaine adventure and getting off of opiates, and the respect I have for that addiction. But blood pressure medicines block REM, muscle relaxants, and benzodiazepines. They all block REM, and so all these main drugs that we're giving people that have depression and have PTSD are the exact opposite of what we need to be giving people. Now, if you contrast that with something like methylene blue, and we think about, okay, well, there's some large clinical trials. There's a human trial with 1,500 participants, and the results were fantastic with depression, because methylene blue, like I said earlier, works on nitric oxide, but also acts as an SSRI, and it's a very powerful mitochondrial support. And so they call it the magic bullet because it does so many different things, but doesn't really seem to harm the body. But if we look at the study that they did on memory consolidation with methylene blue, they found that they were looking at phobias. And so they would like let's say I was afraid of spiders, right? So what they would do is they would put a spider in a jar, right? Maybe the first day, and the second day, maybe they would even have me hold it, right? And eventually I would get okay with it. But what would be really important would be I get exposed to that spider, but I need to sleep on it, right? I need to consolidate that memory because the PTSD is in the long-term memory banks, right? So what they found is they gave one dose of methylene blue after a phobia therapy session, and the results were much better. And so they concluded that methylene blue seems to have a positive effect on memory consolidation because these memory consolidation pathways are in the locus ceruleus. And in Latin, that means blue spot, which is, I think, so cool because methylene blue spot. So the blue spot's in an area in your brainstem called the pons. And this is where it's like a thumb drive. Our short-term memory is stored in the locus ceruleus. And if we get REM sleep, it's transferred up. And this is this memory consolidation. But these cells in the locus ceruleus are very, very dense with mitochondria. They need a lot of energy. And so as our energy levels decline a little bit, these higher demand centers, like in your brain in particularly, suffer first, kind of like the canary in the coal mine. They're the first, they're the most sensitive when we start getting dwindling energies. So I just think it's really fantastic when we really look at, and I'm on the kind of the tail end of a new book that's just all focused on this subject, on the locus ceruleus and the blue spot and memory consolidation and tying it into methylene blue. And really, it's the locus ceruleus is where Alzheimer's is thought to begin. And the connection with Alzheimer's and a lot of the other Parkinson's, a lot of degenerative neurologic disorders, you spoke about it in one of your past podcasts where they talk about nasal hygiene. You spent a lot of time on this, yes?
We talked about it last time, I believe.
Well, you spoke about it with the neurologist guest that you had.
Okay.
Yeah.
It's hard to recall exactly. There's been so many conversations over the years.
Well,
but I remember we talked about the doorways.
Right.
And I believe we talked about nasal as one of those.
Yes. Right. Okay. So we'll let people refer back to that and not, we got a lot we can talk about.
So methylene blue, great for mitochondria. We talked about melatonin and the benefit there to mitochondria. Any synergy between those two when it comes to energy?
Well, they work in different ways. And, you know, I love to talk about this. I'm glad you asked the question. It tells me that you're really getting this and you're seeing the light. And honestly, those two molecules together are just a dream, absolute dream. I have to say it's made my job a lot easier as a physician to have those tools. And it's also allowed us to work with people all over the world and get fantastic results with people, because they help to mitigate a lot of the challenges that we had prior, which is just we just didn't have the life force with people to work with to get them healthier. And so when you look at melatonin is basically it's keeping the energy going in the mitochondria. Okay. Methylene blue doesn't do that. We don't want the mitochondria shutting down. Okay. And, it's interesting to look at this one study that, so back in the beginning, when they were first researching melatonin, they didn't think melatonin did anything. They thought, because they were giving it to these mice that were, it was almost like they're basically living at the Ritz-Carlton, because the laws with these rodent studies and experiments were very strict. They're fed regularly, the food is really healthy, the air quality, their water's changed regularly. So they're not stressed. And so then they went back, this is in the 60s, I believe. They went back and they said, well, what if we stress these rodents? And the way they stressed them was they put them in these tubes for like extended periods of time every day, right? So they had imagine being stuck in like a tube. You couldn't move and it was dark and so this triggered all of these diseases. And so they saw a lot of the diseases associated with industrial culture, where they were getting diabetes and cancers and high blood pressure. And so then they looked at dosing these rodents with melatonin, and it totally mitigated a lot of the diseases. And so if you look at that, it's like, okay, it's buffering stress. So melatonin's buffering the stress, it's keeping the energy in the mitochondria. What methylene blue does is it then jumps in and it enhances the mitochondria, and it's an antimicrobial. Melatonin helps with infection, not by as an antimicrobial, but by keeping your white blood cells working. Because if the infection gets to a point where the inflammation is so high, then the mitochondria at some point are going to shut down within those immune cells. And then the immune cells don't have the energy to continue the battle, right? And that's the end. And that's what happens with these infections and how we will die from them. And so if we can go and give melatonin in high doses, and back in the COVID days, hospitals were dosing patients with hundreds of milligrams, even up to 400 milligrams. I know they announced that when Trump got COVID, right? But then all of a sudden, it was gone. You couldn't see anything except vaccine. But in the beginning, like, you could go to the hospital and pull up their protocols, and part of their protocol was these high doses of melatonin. And so methylene blue works with that hydrogen peroxide aspect. So they're very, very synergistic, and we will often combine methylene blue. In fact, we have one of the Sandman bars. We have it where it has melatonin and methylene blue together.
When it comes to safety, people starting to take either methylene blue, melatonin, any concerns?
Well, there's some considerations with regards to SSRIs and methylene blue. And there's based on a study I'm sorry, not a study, but some incidents that happened where they were doing surgical thymectomies. So there were patients that had cancer of their thymus gland. So they gave them high doses of methylene blue IV, and then you could see the thymus gland, because the thymus gland would pull up a lot of the methylene blue because there's a lot of mitochondria in there. And so then they could make sure that they got rid of all of it. But the patients that were also on SSRIs had serotonin storm, and some of them actually it caused death. But so serotonin storm is a real and a serious condition. However, the Mayo Clinic retracted the warning. So they basically did a blanket warning saying no SSRIs and methylene blue. And so then the Mayo came back and retracted that and said, well, no, it's just this thymectomy and these high doses intravenously are the problem, which they're right. But if you are taking SSRIs, just you want to be aware of this fact.
What about melatonin and safety? Any concerns?
The only thing with melatonin is that most people are pretty knocked out, and like if you have kids, and you have to be able to wake up and navigate a little bit, there's a adaptive period where you do get used to that high dose, but you're pretty groggy. So it could be hard if you're having to get up in the middle of the night or something like that. But then you get used to it. Like I have no problem. Like you could wake me up at midnight and I'd be fine. But I've also been taking high dose of melatonin for about 6 years now. But it took me a few days, I would say a few days of the higher dose where I would wake up and I would really feel really groggy. The secret is getting light in your eyes, sunlight in your eyes, and that'll really kind of get you out of that grogginess.
Isn't there some kind of contraindication with methylene blue for people with a genetic abnormality? Talk about that.
Yeah,
And how common is it?
there's a G6P um, genetic. It's very rare. You can test it at most labs, but there is some thought that glutathione in particular might be challenging with that. Also ozone, but not with melatonin.
Methylene blue is a problem though, right? With that?
I'm sorry, you're right. With methylene blue.
In practice, have you seen anybody with that?
Uh, Super rare, maybe one or two people. Yeah, it's really rare.
Okay. I want to close the door on melatonin, but one thing I think we need to talk about is at night and darkness, and how if we're not protecting against light on the other end, that can suppress our melatonin.
Mm-hmm.
We've talked about it from the angle of stimulating, getting light during the day, and that helping the pineal
Right.
and producing our own. But we got to be careful on the other end at night, not to allow light to ruin our own melatonin.
Correct. Yeah. And so there's an argument to have total darkness in the room. Like if I'm traveling, sometimes I'll have those little green lights, on those smoke detectors, and it blinks. And I can't sleep with that, because I've gotten so accustomed to sleeping with the light, total darkness. And also in your house, I don't use the lights, and the can lights in the ceiling and so forth. I set up lamps with red lights, and I have them controlled by this remote control outlet, little remote control thing. I talk about this in my melatonin book. And I actually just had a patient that came in for a consultation regarding his prostate, and he had read my melatonin book, and he was talking about, oh yeah, I did what you said in your book, and we set up all the lamps, and it's like now I go home and it's like if anybody turns the regular lights on, it's like jarring to me. But yeah, once the sun goes down, you want to protect yourself, and you'll get much deeper sleep if you do that. It's going to be better for your circadian rhythm. And another fact that a lot of people don't realize is that Wi-Fi goes through your brain and through your pineal, and the pineal doesn't know the difference between light going through your eyes through the suprachiasmatic nucleus versus these waves from EMF, and that's one consideration for turning your router off at night.
John, before we part ways, we've talked about a couple times now this injury you had to your leg. Let's really take some time, get into that story and where you're at now with that. So let's go all the way to the beginning. You had a fall. I believe it was a year and a bit ago.
Mm-hmm.
Take it from there.
Yeah, it was late 2023, and I had a slip and fall, and I was taken to the hospital for what they diagnosed me with was compartment syndrome, which is basically where your leg swells up. So they recommended this fasciotomy surgery, which, I wasn't really crazy about, but, when you're in the hospital and you're in excruciating pain, you're kind of going to go with the flow a little bit. So they basically filleted my whole leg open, and I requested, can I get into the hyperbaric oxygen chamber, and that's a clear indication. And it was right in the middle of the hurricanes, and I had kind of a quirky doctor that never heard of photobiomodulation, never heard of light therapy, just really super allopathic, and was adamant that I would not get in the hyperbaric chamber. And basically, they got terrible food in the hospitals. The lighting's terrible. Because it was the hurricane, they had us move to this separate section of the ICU, and all you do is hear people screaming all night. And so this was the environment I found and also you've got a blood pressure cuff on you that comes on and off every 15 minutes, and it's beeping, so you can't really sleep quality. They're giving you all these medicines. And so eventually I just had to get out of that hospital, and they weren't providing any form of therapy, and I could see that my leg was I couldn't move my foot, I couldn't feel my leg, and I had these gaping wounds, and so I moved to a different hospital, and immediately the surgeon looked at my leg and said, "We need to get you into surgery right away." And I said, "Okay." And then I woke up after that surgery and I had virtually no muscle left in my leg. He had to basically remove so much necrotic muscle that there just was nothing left. So, that was kind of the point, I think, of no return, where eventually I made the decision I could either keep the leg and walk around on this basically, peg leg that I can't feel or move, which I didn't really think would be a great idea. I chose the route to have it amputated to get into a prosthetic, and I could return to all the surfing and paddleboarding and all the different things that I wanted to do potentially, and which is true, it's happening. So day after my birthday, I remember we had Maha here. We recorded a big movie with RFK, and they were going to the different. On my birthday, February 25th. Me and my staff, we had patients fly in, and we're recording for Maha, and then I knew the next day what was going to happen. Right? It's like tomorrow I'm getting my leg amputated, and so that was an interesting morning, waking up knowing that's going to happen. And so I had the leg amputated, and then within a few days I went septic and had to go back to the hospital, and they tried to clean it up and then sent me home, and then it got infected again, and MRIs and more surgeries and IV antibiotics for another like almost a year. That's what really took it out of me. I mean, leading into that amputation, I was still pretty vital. Like I had good muscle mass, and I felt pretty healthy. But boy, I tell you what, after those 9 months of all those other surgeries and the IV antibiotics, I had nothing left. I mean, it took a lot to dig out of that hole. And maybe there were some times I even lost hope, where I was feeling like maybe this is, I don't know if I'm ever going to get back to any level of health and fitness and getting back into the clinic. Mentally, I was confused. My brain just wasn't working. It was 18 surgeries, it was a lot of anesthesia. My anxiety was just off the chart. I couldn't even deal with the couple of times that I came over here to deal with patients with consultations. It was just the hardest thing I've ever done in my life, just even dragging myself over here and handling that. So there was definitely times where I was wondering whether I would ever be able to return to what I love to do. And I can tell you, I am there, I'm here, and enjoying it quite a bit, and feel like I'm cycling. I did a little video on my social media this morning showing how I'm using the special shoes that lock into the pedals, to be able to really cycle with a prosthetic leg. And you have to figure out workarounds because you can't really feel your foot. So you constantly having to look at it and make sure visually you're walking up a ladder. It's easy to slip off when you're not, have a good foot. So a lot to get used to with prosthetic, but boy, great time in our history to be in this situation because the technology is really nice with regards to that.
John, what did you learn going through this whole experience with your leg that most people wouldn't understand that haven't gone through it?
Well, it's been an interesting journey emotionally, and I think it's really stripped me down uh, out of my ego into just being with you know the true essence of myself. And um, it's also allowed me to face a lot of aspects within my ego. A lot of family dynamics and um, fears, a lot of fears that I've had with death, with disease, with disability. I've always been able to take care of myself, and there were many, 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 many many months where I couldn't do anything for myself. I needed just full time nursing, and having people show up. It was really really amazing, and those relationships that we have in our life are so important because when that type of thing happens, um, it's nice to know that you have a support system around you that's going to take care of you. And I know there's probably some people out there listening to this that might not think that they have that type of support system. And I was one of them, but boy, did they show up when the shit hit the fan.
Do you think either already or up and coming, this experience will change the way you work with patients?
Well, it's given me a lot of empathy. I already had a lot of empathy, um, but it's given me a lot of empathy for, um, gosh, I'd say when I look at the opiate situation, I've got a lot of empathy for addiction and this getting off of opiates. I definitely needed to be on opiates. I mean, I'd show you some pictures of my leg. You'd be like mortified. Um, but getting off of them was very, very difficult. And so that has really been an interesting aspect. And then I think um, further just enforcing the power of melatonin, because I know how supportive that's been for me through this process. I had to sneak it in the hospital. They were only going to give me 8 milligrams at bedtime. So I had to sneak, and then I snuck in the methylene blue, and then my urine was blue, right? And the nurse is like, "Wow, what's going on with your urine?" "Oh, I'm having beet juice."
Did they buy that?
One did and one didn't. She's like, "Oh, you're taking methylene blue, aren't you?" And she was kind of wink, wink, nudge, nudge. But some people in the hospital really get bent out of shape, and there are very strict regulations with that. And I was doing peptides in the hospital as well, and so those are by injection. And one time, one of the needles fell on the floor, and they found it, and it wasn't the type of needle that they used. It was like, so they thought I was injecting drugs. They were convinced that I was doing drugs there. And so they moved me to a separate room. They had a camera on me, and I was one of the high risk. It was like absolutely a joke, but um,
As we come to a close, last question for today. I know two of your responses to this will be melatonin and methylene blue, but give me three more things people should consider to support the mitochondria.
every morning that I go to the beach and I do grounding, right? And I think grounding is a way to kind of get rid of excess electrons in the body, and that kind of reduces some stress and can help support your mitochondria. Um, I like to do breath work in the morning. And so anything you can do to support your parasympathetic nervous system is going to be good for your mitochondria, because you're taking that fight or flight stress response down a bit, a few notches. So I think breath work is one of the best ways to really support the autonomics, along with the high dose melatonin. That was probably at the top of my list of things that are really needle movers, lever movers for that.
Somebody brand new to breath work, is there a certain protocol, app, YouTube video they can get started on?
I'm a fan of the Wim Hof app. I set the Wim Hof app to 30 breaths, and I do 20 breaths in through my nose, out through my mouth. And then I do the last 10 in and out through my mouth, because I'm trying to get rid of as much carbon dioxide as possible. And then I go into a breath hold for 2 to 3 minutes. And after the breath hold, I inhale fully and sip and really expand my lung cage, and I'll do a twist. I learned this from Stig Severinsen, he held his breath for like 22 minutes. He's got a bunch of world records. He came out and spent a lot of time with me. Actually, we co-wrote a book together that we just recently released called Airways, that it's on Amazon. But so he showed me this maneuver, and so you're getting this expansion to the rib cage, and you're holding your breath for only 15 seconds on a full inhale, so that the longer breath hold is on the full exhale. Then you're fully inhaling, twisting, expanding your lungs. Now be prepared for a big head rush, and I find that I'm able to lean into a little bit of a bliss with that, because kind of shuts the monkey mind down. And I sit with that for a few moments before I go back into the next round. And I do 3 to 4 of those rounds with the Wim Hof app. And that's something I've been doing for a year or so now, and it works really well.
Any honorable mentions to add to the mitochondria list?
Well, the whole taking care of your doorways is such a big thing. Minimizing inflammation is really at the key. So we're looking at a lot of these things like saunas we talked about before. That those are going to lower inflammation. They're going to help with detox, which is going to indirectly help your mitochondria. The red and the near infrared light is going to activate melatonin, which is going to then support your mitochondria. Hyperbaric oxygen is another really good support for the mitochondria. You can breathe CO2. We have a device that we sell at mitozen.com called the Carboxyzen, and you hook it to a CO2 container, and you're breathing CO2. And what happens is your CO2 sensors, which by the way, it's in the blue spot, the locus coeruleus has got your CO2 sensor. So when you're holding your breath and you start getting that panic feeling, that's basically your locus coeruleus dumping norepinephrine, that creating a bit of a fight or flight. But what happens is that sensor is too sensitive. And if we can change that to make it so it's not so sensitive, our body relaxes a lot more. And CO2 is a vasodilator. So a lot of times we overbreathe, and we overbreathe our CO2. And so then we have a lot of vasoconstriction. So this is another way to look at nitric oxide, because nitric oxide and CO2 have some similarities there. but you can really enhance your circulation by slowing down your breath and actually accepting a higher level of CO2 in your blood. And you can do that by actually doing breathing with CO2. And you can also do it with, like with what I'm doing in the morning, is I'm doing this extended breath holding, which helps to reset it. And so these things can also be very beneficial to the mitochondria.
All right, John, we're going to leave it there for today. Thank you for coming back on the show, sharing your story. You're looking good. Happy you've come through to the other side of this journey with your leg. I'm sure there's still parts of the journey that are continuing, underneath what you're sharing today. But again, you're looking great. Appreciate you coming on and being so open and vulnerable. We're going to link up MitoZen, your books, social media, everything in the show notes. Thank you.
Thanks for having me, Jesse. It's been a pleasure.
Thanks for watching the episode. I got another great one lined up for you right here. Don't miss it. I'll see you over there.
People really need to know about melatonin, and they don't know. They have half-truths. There are thousands of published articles on melatonin. That's why I can't understand why melatonin isn't getting